Hi, and welcome to Health Trust TV. I'm Paloma Cano.
And I'm Adam Morrella, and on today's show we'll be discussing the importance of oral hygiene.
We are delighted to have in our studio Dr. Jessica Ray from the Health Trust Children's Dental Center, located at Tropicana Shopping Center in San Jose. Welcome.
Thanks for having me.
Yeah. So Dr. Ray, it looks like you brought in some fun props for us, but before we get to that today, let's start off with talking a little bit about your background. How long have you been a dentist, and how long have you been with the Children's Dental Center?
Well, actually, Adam, I started off as dental assistant, and then I continued with school and went to dental hygiene school. I practiced for about 8 years, and during that time, that's when I found the Health Trust. And I did volunteer as a dental hygienist with the Health Trust. And then I continued on to go to dental school, and after dental school, here I am and working with the Health Trust once again.
Very nice. So let's talk a little bit about the Children's Dental Center. What is it and who does it serve?
Well, the Children's Dental Center, it's a unique project. It serves underserved community. That's our target group. We are a partnership with, it's Children's Dental Group, partnership with the Health Trust, First Five, and El Camino Hospital.
Very nice. So when should a child first start going to the dentist?
A child should start going to the dentist usually by their first birthday.
Oh, wow.
Yeah, so very early on.
So what is the best thing that a parent can do to keep their children's teeth healthy?
I would say the earliest visit within that first year to educate the parent and to educate them in preventing early childhood caries. That would be the best thing to do.
And so you mentioned before the year of their birthday to go to the dentist. Why do parents need to bring in their children to the dentist before their first year birthday?
Well, educating them at an early age and starting good habits at home and learning how to take care of the teeth, and that helps them have healthy teeth and gums and allows them to have a healthy lifestyle as well.
Great. So how do parents get dental insurance for their children?
Well, there's two ways of doing it. They can go to the website, www.healthtrust.org, or they can search on the web for Children's Dental Center, and they can pop that on the website.
So Dr. Ray, can you tell us what are some important things that parents should know?
Well, I think a pretty important point would be the number one reason why children miss school is not due to the flu virus. It is actually due to teeth pain. Wow. So a toothache keeps a child out of school.
Wow.
So that's the number one thing that keeps them out.
What are some other things that parents should know?
Well, I think they should know how often to bring their child. Children should come every 6 months. They get their teeth cleaned, examined, and x-rayed. And in between there, they do home care, and that's real important that the parents keep up and watching their children, make sure that they're brushing at home properly.
And this all starts at a young age, before the year?
Yes, a child should come before their first birthday, and we educate our parents on how to take care of even infants. Wiping their teeth with a baby cloth is, would wipe away all the bacteria out of the gums, and they start getting teeth at 6 months. So wiping that and not allowing milk to stay on their teeth to avoid baby bottle caries.
So it's important for little children to brush their teeth after a bottle, not sending them to bed with a bottle.
Not sleeping with a bottle. They can sleep, have water instead of milk, and just to wash that away, but they should be wiping after each feeding. I prefer them having the parents wipe after each feeding, and that includes also nursing too. Yes. There is sugars, natural sugars in the breast milk, and that should be a big part of the nursing process, nursing the baby and then wiping after the feeding.
Great.
So Dr. Ray, it looks like you brought in some really fun props here today. So what were you going to demonstrate for us?
Well, I was going to demonstrate a brushing technique. Okay. So I brought my big teeth. So these are my big teeth and big toothbrush. For kids, we try to have a little bit of fun with it. So we do the wiggle and jiggle technique, and it's actually pointing the toothbrush at a 45-degree angle and brushing in circular strokes. But with kids, we try to have a little fun and get them interested, and you want to say wiggle and jiggle, wiggle and jiggle. For the adults, you're going to say, brushing in a circular stroke toward the gums, and always using a soft bristle toothbrush, never a hard bristle toothbrush.
Okay.
And I also brought a couple of other things to show you. I do recommend, these are just regular toothbrushes. You can buy them at the grocery store, really inexpensive, and they're all soft bristle, but you need to have the right size for the age group. So the smaller the child, you need a smaller head toothbrush, and then as they get into more preschool, they have a little bit larger head, okay? And they also have a larger handle grips. Because children are small, it's difficult for them to have the dexterity to brush their teeth. So that's why parents need to brush their teeth with them, because children really don't have the dexterity to brush properly. Okay.
And there's also children's toothpaste as well, right?
Yes, absolutely. So the children's toothpaste does contain fluoride. You definitely want to do that. You want them to only use a pea-sized drop, and then allow them to spit out or wipe out the excess fluoride. Also, I recommend, these are easy. It's not an electric toothbrush. It's really inexpensive for the adults. It's just a battery-powered toothbrush that they can get at any grocery store locally, and it's really inexpensive. So this is really good for the adults. So,
and so how often should children be brushing their teeth a day?
Well, for infants, you want to wipe them at least once in the evening. Children, once they get into toddlers, you want twice a day, and actually start flossing in the evenings with even a toddler. Being that some teeth are really close together, you want to make sure you remove all the food and bacteria and debris, not allowing it to stick overnight, all night on the teeth. And then as for adolescents, definitely they need to brush twice a day and also start brushing their tongue. As they get older, they're eating more foods. We want to kind of course them eating more healthy foods as well. You find adolescents start to drink sodas, coffee drinks are very popular, energy drinks are very popular. They have a high sucrose sugar intake. So we want to try to educate our children, and as they grow to adolescence, it changes.
Yeah, so, I think a lot of people pay attention to the sugars and candies and stuff, but they're not really keeping an eye on the drinks, right?
Right, yeah. You find a lot of teenagers now at Starbucks, and there is a lot of sugar, although I love Starbucks, but we have to make sure that, they brush properly and they know how much sugar intake they are getting in one drink.
So Dr. Ray, I noticed that you brought in some dental floss. What's the difference between brushing and flossing, and how often should we be flossing?
Yes, well, the difference between brushing and flossing is when you brush, you just get the outer surface of the teeth, and that's getting the outer surface of the tooth clean. When you floss, you're getting actually in between the teeth. So if you just brush alone, that is really leaving lots of food and bacteria in between the teeth, can cause gum disease and caries in between, cavities in between the teeth. So you also, for adolescents, they need to floss at least once a day, and adults as well.
Okay, great. Well, thank you so much for coming in. Those demonstrations were awesome.
Thank you. No problem. Thanks for having me.
Be sure to stay tuned. Up next, we'll show you how to make some tasty fruit and veggie-filled smoothies. But first, here's Elena with her segment, The Healthy Choice.